about the revenue cycle of the future. All too often in the revenue cycle of today, we worry about ourselves. We worry about the provider, we worry about the payer, where the money is going, how's it going to get there, what the bills look like for us. We forget one essential component. We forget the patient in the mix. So the revenue cycle of the future puts the patient at the center. We worry about the patient's experience, not only clinically, but when it comes time to pay their bill. Is their bill clear? Do they understand what they need to do, where the money needs to go? So today, to follow the revenue cycle of the future, what we'll do is we'll follow our patient, Carol. Carol is a retired woman, and she's very active, but unfortunately she trips in her home. And when she trips, she feels an immediate pop in her knee, pretty acute pain that she knows right away she's unfortunately going to need to get looked at. So the first step in the revenue cycle of the future is helping Carol find a provider that's both within her network and within her price range.
As Carol starts to look for a provider to go seek for care, the first thing she's going to do is log into the Change Healthcare platform that's made available to her by her health plan. When she logs in, she'll be able to search for an urgent care facility that's in her network and close to her home. When she types urgent care, providers and services are going to be brought back to ultimately give her an option to pick which facility she wants to go to and learn more about. As she clicks on Fast Care Medical, the platform will bring back the locations that this clinic is available at, as well as the patient reviews, so she can make an informed decision on where she goes to seek the care.
The Advisory Board's online scheduling platform is designed to meet consumers and Carol where she is. So embedded in the Urgent Care Clinic's website is an ability for her to schedule online and skip the wait at the urgent clinic. Within a couple of clicks, she can see if there's availability later today and is able to get into the clinic, again, skipping the wait and being able to do that all within a few clicks. She's also able to complete her pre-registration form, further saving her time. And given that she's been to this clinic before, her record is pre-populated here. So again, she's not spending a lot of her precious time filling out the form. She's able to confirm the appointment and get into the clinic.
So now Carol arrives at the clinic. And like we said before, she has been here before. And Carol is going to use her own mobile phone as her identity token. So when she arrives, the registrar will simply open up the AIMI app, which is the Lenovo Health Authoritative Identity Management Exchange powered by LifeMed ID identity platform. And as you see here, she can click on Mobile Token and generate a QR code. Before I do that, I did want to mention that the mobile token is just one of the approved identity tokens that we offer. We also have biometrics, the BYOID, and you can also do a manual lookup. So the registrar is going to generate a QR code, and here on the patient-facing tablet, Carol opens up the AIMI app, scans the QR code, and enters in her passcode. This is a unique passcode that only she knows, and this is the second factor authentication. The phone is something she has, and the passcode is something she knows. And as you see here, automatically, her record pulls up. So here on the patient-facing tablet, Carol can review her information to make sure everything is accurate. In addition, the registrar is able to run verifications to ensure that the person is who she says she is. For identity, it'll pull up to make sure that we have her accurate social security number, and it's not on any list as, for example, the death registry list. Then we can also run an address verification to ensure we have her most updated address. As you see here, a warning pops up. It looks like we are missing one of the words from her address. So we are missing the word north in North World Drive, so the registrar can go ahead and update that address in her EMR. In addition, we can run an insurance verification. So we have the most updated information for her copay and deductible through a simple 270-271 transaction. And now that we have this information, we're going to pass it off to PatientCo for payment.
Now it's time for Carol to pay her bill, and we make it really easy for her to do that. So we'll open up the PatientCo payment screen. And because Carol has been here before, we already have her card saved on file securely with point-to-point encryption. So all we have to do is ask if she wants to pay with that HSA card she left on file. And because she does, we'll click pay. And it automatically sends an e-receipt to her mobile device or tablet so that she can have her future record.
After a seamless checkout experience, Carol is guided to a kiosk that is set up right next to the checkout counter that enables the clinic to gather real-time feedback from Carol, as well as an opportunity for her to leave some feedback for the clinic before she leaves. It's a very quick and easy to use form. She's not super technically savvy, but there are a couple of questions just around her experience. Is she likely to recommend this clinic to friends and family? Was it easy for her to get into the clinic? And other questions around wait time, convenience, access, and perception of care that again enables the clinic to engage with her as a patient as well as everyone that comes through their doors. Now, during this clinic stay, Carol unfortunately learned that she needs to explore knee replacement options, so handing it over to Change for that part of her journey.
So knowing that Carol needs a knee replacement, she again is going to log into the Change Healthcare application and start searching for knee replacements. When she begins her search by typing in the keyword, we're going to bring back in-network costs as well as providers for her to make an informed decision on where she wants to go. You'll see we provide clinical and patient review information as well as what the total cost of the service is in conjunction with what Carol is expected to pay. In this example, Carol would like to know more about Dr. Adams. By clicking on his name, we bring back the patient level reviews for Dr. Adams as well as the affiliations that he practices at. Carol decides that she would like to see this provider at the facility General Medical Center. By clicking on that, again, she'll learn more information about the reviews available for that facility as well as the clinical quality information that's available.
So again, now that Carol has full transparency into the best financial and clinical option for her, the advisor board wants to make it very easy for her to get in to see Dr. Adams. You can see here on the screen that we can quickly pull up his availability. Again, this is the online scheduling platform that's embedded on their website, so she doesn't have to go pick up the phone, she doesn't have to do a provider search. She can just easily see when Dr. Adams is available to see her for a consult and is able to book an appointment this Friday morning, this upcoming Friday morning.
So now it's Friday morning and Carol has arrived to the surgeon's office. Now Carol has never been to this office before and she is not known at this location. However, this location does use the AIMI identity platform. So it's a very same experience for Carol when she arrives because she can just use her mobile phone here, pull up the AIMI app, and it's the same as we did before, go ahead and generate a QR code, which she will then scan with her phone, and then she will also enter in her PIN code again, and automatically the information will be pulled from the AIMI cloud and it'll appear here. So for the registrar, she does not have to do any kind of manual data entry in order to get this information, even though she is not known in this EMR. So here, she's gonna say, yes, I wanna import this data from AIMI, and she can choose which type of information she would like to import. For example, we're gonna copy all of this information and press OK. And as you see here, the information is automatically populated into this EMR through API or scripting. And lastly, the registrar can do any of the identity proofing again, but she can see that all of these were ran yesterday at the clinic, so she does not feel that she needs any more information. We can also print a wristband from the AIMI UI, and this ensures a closed loop system. Here we have another way to identify Carol with her picture, her MRN, date of birth, and barcode. And that ensures that she's accurately known throughout the care ecosystem. So now that she has her identity, she's now ready for payment.
Now it's time for Carol to pay again. So we'll open up the patient payment page. And the cool thing about Patient Co is since it's cloud-based, we can see that she actually has a outstanding balance from the urgent care and a balance from today's orthopedic evaluation, which then totals it for us so that we can ask for the most payment up front at the point of service and collect the most. We also know that her card is still saved on file, which we can ask if she would like to use that payment and then ask pay. And she continues to be on her way.
Unfortunately, during that evaluation, it was determined that Carol needs a total knee replacement. So she does end up inpatient with us at General Health System. And while she's with us, it's essential that we support her experience not only financially, but also as a patient in the hospital. One of the ways that we're able to do that is through iRound's leader rounding technology. What that allows us to do is gather feedback from Carol while she's with us to make sure that we are taking care of all of her needs clinically and experientially, and also educating her financially before she's discharged and received her bills. One of the things we see on our experience status map is unfortunately that Carol is red. What that tells us is Carol has had a negative experience. It turns out her bathroom is dirty and she's complained a few times, but it hasn't yet been addressed. So she will stay red, alerting folks that she does have a need until that's resolved. We do still want to go ahead and have a leadership conversation with Carol to understand that we've met all of her other needs. So we talked to her about things like plan of care, ensuring that she understands what's going to happen next and what she needs to do, responsiveness, ensuring that we are responding to her needs as they come up, as well as her financial education. We do want to make sure that a patient financial advisor has come to speak to her about what's going to happen next after she's discharged, what she'll be responsible for, and what that's going to look like when she gets the bill. Finally, as we think about discharging Carol, we do of course want to support those care transitions to make sure that she's looked after at every step along the way. We're able to do that with iRound by actually recording her clinical discharge instructions to make sure those are available to her after her discharge. Historically, of course, we'd hand off a big old packet of paper and expect her to read that at home. But what we're going to do here is actually record the instructions as the nurse or provider is giving them. What that means is that they then become available in the EMR and also the patient portal so that she can access them after discharge and listen to her caregiver giving those instructions to ensure that she's following all those steps, ensuring that she's not readmitted, that she doesn't get yet another bill for being readmitted, and we're avoiding any value-based purchasing penalties. Once we've done that and Carol is discharged, it of course becomes very important that she gets her bill in a way that she understands, is clear to her, and is really easy for her to pay.
Now that Carol is home, we want to make sure that she's really focused on recovery. That's the most important thing. However, we need to make sure also that her bill information is very clear to her. And as is a typical situation, she's going to receive a number of different individual bills, and she's going to receive a number of individual explanations of benefit. And that can oftentimes cause a lot of confusion. But for Carol, she's actually taking advantage of the health payment system solution, which provides her with one single statement, somewhat similar to a credit card statement that she receives once on a monthly basis that shows all of the doctors that she may have seen, even though she might not have seen, like an anesthesiologist, for example, showing on one bill. So she has the opportunity to have all the information she needs. She just needs to make one payment, and all of the doctors are paid. What a huge convenience for her. We also make this available to her in paper form if that's of her interest, or she can take advantage of going online to our portal or our mobile device to be able to look at any of her information. The health payment system solution makes sure that she has access to information for many years, so it's almost like her personal medical record. She can see all of the claims activity on her portal for all of the claims she may have had over a lengthy period of time, which if she was self-employed or she might have been needing it for tax purposes, she has access to all of that information. All of her statements are also available. And of course, the payment methods that she likes to use are also stored within the platform in a secure fashion. Now that Carol has had a really good experience and knows that she just needs to make that one secure payment, we want to make sure that she's continuing with her care in a very effective manner.
So now that Carol has completed her knee replacement, the Change Healthcare platform will send her an automated communication. And in this email, we will explain to her the next level of benefits she has. And in this example, it's around physical therapy. So by clicking the sign in button, it will authenticate her, bring her into the platform, and we'll start explaining to her the benefits that she has available to her for this service. But more importantly, we're displaying the in-network providers as well as costs to receive that service. And that concludes Carol's experience through the revenue cycle of the future.